teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my Florida neighbors and my friends and all over the country. Tonight we have a very special guest, Dr. Voorn. She got quite a resume, and I think she's with the Chen Medical Group. Am I correct?
Correct.
And along with her, we have the manager of the Chen Medical Group, Brandon Glanville. Doc, tell us a little about your background, how you got into medicine, what's your education, how many years did you go to school, and you went, I understand, to a couple of local colleges. Am I correct to get your master's?
Correct. Yeah, I was actually born here in Boca Raton, so I'm local. I was raised in Boca, did, elementary school, high school here. I did my undergrad at UCF, and then I did medical school at Nova Southeastern, so down here in Fort Lauderdale, and wanted to stay local, and ended up doing my residency here at Broward Health and also in Fort Lauderdale. And now I'm with Chen Medical. Our center specifically is called Dedicated Senior Medical Center.
And tell us about Chen Medical. What is Chen Medical basically? Are they accepting patients with multiple different insurances, special insurances? And how would they get an appointment with your office?
So Chen Medical is a medical center that specifically serves seniors, 65 and older. Chen Medical is what would you say?
They're the parent company?
The parent company. Dedicated Senior Medical Center is our specific branch. We have 3 branches here in Palm Beach County. We have the Green Acres branch, the West Atlantic branch, which is where I'm medical director at, and we also have the Riviera Beach branch. So we take 4 insurances. We focus on managed care. So we take Aetna, Florida Blue, WellCare, and Devoted.
So under your program, you're trying to keep your patients compliant, correct?
Correct.
In order to keep them compliant, you must see them at least once a month, twice a month. As many times you have to see them, you see them.
Exactly. So our biggest thing is to keep our patients healthy, happy, and at home. So we really focus on seeing them once a month. The ones that are more critical, we see them bi-weekly, just so we make sure that we address all the issues, because patients can have a variety of complex medical conditions, and it's hard to address all of those things in one visit and say, see you in 3-6 months. So we like to do short, focused visits, about 20 minutes with each patient to address one specific issue each visit, and then have them come back as frequently as needed so they understand and that everybody's on the same page.
That's right. And Brandon, what do you do with the company?
So I'm like the business partner side of it, where I help to run the front office and make sure that appointments are scheduled and that we're doing all of our phone calls, making sure we're getting everybody back over there, and just making sure the lights are on, right? We want to make sure the AC's going, so
Make
when
sure
they come
you're
in,
getting paid, right?
That's right.
Paid.
So
now, when you're with Chen Medical, is it owned by Chen or is it owned by you guys individually? Is it like a partnership?
Sort of. So Chen Medical, they're the corporate office, and we're what they call the center dyads. So I'm medical director there. Brandon is the center manager. So we work as basically like the mini CEOs of the company to try to make our center as profitable and as efficient as possible. So we're keeping our patients happy and out of the hospital.
That's fantastic. So you basically have a provider number to bill for, correct? You got to have a Medicare provider number. I guess Chen has that.
Correct.
And what Medicare Advantage is, a lot of you patients don't know, it usually takes a Medicare patient who's on straight Medicare, and they don't, if you see Joe Namath and everybody else is advertising Medicare Advantage patients, because now you get Meals on Wheels and you get all these extra things that they promise you, you probably will get them. Some companies will run it a little better than the other companies. So it's a question of you seniors out there, if you're looking at it, you're looking at saying, well, I really can't afford the co-payment right now and I want to get on to a different product, but I want good quality care. That's what Dr. Voorn provides with Chen Medical. And you have like 52 outlets throughout the country?
We have more than that.
yeah, so we are growing. Really, we're adding about 20 centers a year now, but we're up to 80 centers right now in 10 states.
80 centers.
And then every year, our goal is to get to 500 centers in 5 years.
500 centers in how many years?
In 5 years.
That's amazing. Okay. So in all these centers, there's physicians that are located there and other people that basically run the office, correct?
Correct.
And somebody overlooks this. You got to answer to some up higher. And you're on what they call, in order to do this, you're on what they call a full risk program, correct?
Exactly.
Explain what full risk means.
So, do you want? I can explain.
Brandon, you can talk. Somebody
Okay, so our model is a little bit different than like a fee-for-service doctor office, right? Which has been around for a very, very long time, and we all know that. However, where ours is different is that once you're signed up with us, we now take the full risk of you. Like, if you go into the hospital, we're at risk for that, right? And so we want to make sure that we get to know you, build the relationship up with the doctor. We see you as often as needed, and we're here to keep you, like we said, happy, healthy, and at home. So that's what we're here to do. But once you're with us, though, like we're the quarterbacks. We take care of everything, and we're in charge. So
Yeah, so we're not billing per insurance per visit. It's not the way it works. We do the best work we can to keep the patient out of the hospital, because where we're affected is when our patients go into the hospital, because a lot of procedures are done, things that can be prevented. So we focus on seeing them as frequently as possible to reduce costs and to make sure our patients are healthy. And we also focus on preventative medicine. So trying to limit the amount of medications the patients are on and really focusing on their diet, exercise, things like that, everything that we can do to keep them healthy. We also provide acupuncture in our center as well.
So what you're saying, an HMO is called a health maintenance organization. We try to keep you healthy and maintain your health. Is that correct?
Exactly.
And
Yeah.
I'm trying to get the whole gist of this thing.
Yes.
I've only been in it for 40 years. So basically, what you're saying to a patient, do you have to notify the patient if he's on he tells you he's on an HMO, or let's say he comes in, he's a straight Medicare patient, but he wants to get in an HMO. Can you convert him to an HMO?
We can. So we actually have a lot of patients that come to our center, not patients, but prospects that come to our center. They see what we're all about. We explain to them what we call our core model, how we work. We have medications on site. We have a doctor on call 24/7. So they have that access to us. We really like to call it VIP medicine, because I give all my patients my cell phone number. So they have access to myself, as well as on the weekends when I'm not available, they have access to another physician.
So your concierge medicine without the concierge price.
Exactly.
Oh, I'm trying to help you out.
you're doing a great job.
But then as the end result is, there's a patient now. I know a little bit about managed care, and I know about Medicare Advantage patients. And, again, we take straight Medicare at our agency because, I think one of the biggest problems with Medicare Advantage is their home health. Everybody I'm talking to that has Medicare Advantage, it's very hard to get a home health care agency because it's all cost effective. I'm not knocking it, but I'm just saying to you. So the advantage is what people are saying, if they go on an MSO, which is a managing service organization, does the patient have to know he's on that MSO, or you don't tell them? That's a tricky question.
Yeah, I'm not sure the exact answer to that, but
so the answer to that is very simple. Patients now come on. Managing service organization means that the Gen Medical or whoever's running that company, what you said is correct. Medicare and everybody else is looking for cost effectiveness today. That's why they have the ACOs out there. The ACO is almost a duplicate of the MSOs. And I'll educate you a little bit of MSO. The MSO, again, is a managing service organization where you put a group of people in, and you're getting paid by the disciplines. The more disciplines, the more money you get per patient. You can get up to $1,800 a month per patient per month if he has those disciplines. Am I correct? $1,500 per month per patient per month. So you're not doing it for nothing. I mean,
No.
You're getting paid to save money, but you're making money at the same time. That's the whole conquest of medicine. So I always say today, medicine is like old-fashioned. You're trying to make it a little old-fashioned way where you can talk to the doctor at any time. You spend a few minutes with your patient, don't you?
yeah, we do.
As much as you need?
Yes. And we see them frequently. We find that with fee-for-service, the physicians that work in fee-for-service, they see up to 2,000 to 3,000 patients. So it's very hard for them to really get to know their patients. In our model, we see maximum 350 to 400 patients per doctor. So we really get that time to get to know our patients and really
Per month or what? Or per week?
No, just in general. That's the panel, the total size.
Okay, so you got 400 patients on your MSO. Where Medicare might have 6,000 patients. But that patient might only come in twice a week, twice a month, or 3 times a month. Where your patient is coming in, usually the concierge panel is 400 patients.
Yes.
Where they're paying $1,500 a year for that. for the concierge. So you keep it on the concierge level. Am I correct?
Correct.
So what they're saying, folks, you're going to be one of 400 patients that this doctor is going to specialize with you to try to keep you healthy. So that means if you're going to go in there once a month, you're going to see that doctor 12 times in comparison. If you had a straight Medicare, you might only see him 3 times. Mm-hmm. They're going to make sure you're going to come in. If you have multiple diagnoses, you're going to make sure they come in every week, every month, or maybe every week if you need them.
Yeah, or even those patients that might be hospitalized recently, we keep a closer eye on them, make sure that we get home health care set up, we get physical therapy at the home set up, or we make sure we review those medications as soon as they get out of the hospital. We have them come in within 4 days, so we know that we address those issues.
Now, are you basically doing an intervention where if you call them within 24 hours, you're not doing that because straight Medicare reimburses the doc. If he calls within 24 hours, he gets so much money per call. 40. So you're at full risk.
Yes.
So that full risk means, folks, they have to pay. If you go into the hospital, if I'm correct me wrong, they don't want you in the hospital because it costs them a tremendous amount of money. So they're trying to keep you healthy. Am I correct?
Yes.
Correct.
So once they go in the hospital, they're not going to look. They're not going to look for you to payment. They're going to look for Dr. Chen or Dr. Chen Medical. You owe me $35,000. You owe me $40,000. You owe me $50,000. They better come up with the money. But they also have a co-insurance too. I think the co-insurance picks up 80%. You pick up 20%. So they're at full risk for a certain amount of money, maybe $35,000, and the rest of the bills that they pay insurance on that. Am I correct? I think.
Yes, that is how
I'm
it
trying
works.
to help.
You're doing great.
Yeah.
So on average, our patients are seeing 8 times more than a fee-for-service.
They
doctor.
have to be. If they're not, you're going to be in trouble. Because if they're in the hospital, you guys are in trouble.
It's very true, but that's why we build up that
every
relationship.
Time I got a gentleman came to me, and he says, I got 10,000 patients. You're going to have X amount of patients, right? He says 300 patients costing me $40 million a year.
So typically,
He's at risk.
Yeah, typically how it works, the top 10% cost the most.
So guess what? He wants to make sure that $40 million a year is get cut down because every dollar he saves goes in his pocket. He saves money. It's medicine is business. Let's be realistic. Medicine today is business. Not like the old doctor comes up with a handbag and says, "Give me a bag of apples." I just came to see you, or give me a pound of spaghetti. They're not bothering anymore. It's about how can I keep you healthy and how can we save Medicare money. I think we're ready for a break. I'll take a 30-second break.
Okay.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare. All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Your doctor, living longer and healthier. An informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We have Dr. Natalie Voorn, beautiful looking young lady here, and
Thank you.
Brandon, a handsome young man. They run the Chen Medical. Give me the name of the company again.
Dedicated Senior Medical Center.
Dedicated
Senior Medical Center.
They're dedicated to doing care on seniors.
Correct.
And let's explain, what's your phone number?
My phone number?
Not your phone number, the center's phone number.
Oh,
I'm not asking for your the center's phone number.
on air.
How would they get in touch with you?
561-270-48950.
Then I got another number here. It's 561-271-3958. Is that your number too?
Is that your,
Are
no,
you-
that's not
that's-
mine.
Are you a Plainview Circle?
That's mine.
Is that your cell
No,
phone?
yeah.
I'm sorry.
It's okay.
That's the number they put down.
Oh no, that's
Their number is 10644 Plainview Circle,
no.
Boca Raton.
That our center address is 5848 West Atlantic Ave, Suite
Well, they
143.
gave me the wrong thing here. So,
So I
apparently
need
that's
you to do
your
my
address.
number again. I got
Go ahead.
one number off. So 561-270-6950.
And your location again.
5848 West Atlantic Ave, Suite 143.
5848 West Atlantic Ave. What's that near now?
It's in the plaza with La Rue Furniture. It's on Atlantic.
Oh, I know what that is.
Yeah, it's on
Yeah.
Atlantic in between Military and Jog.
There was another center there. There was another Medicare Advantage center there. What was the doctor's name that was close to that too?
Not
There's
sure.
a big, matter of fact, there's a big building.
There's a few in that area
Yeah.
right there.
Because you're right in the center of a lot of seniors in that area.
Yes.
You got an Accenture. What do you get? You know, Accenture. What's the two? You have a large. What's the large senior retirement center there?
Kings Point.
Kings Point.
Yes,
Yes.
we're right next to Kings
Right
Point.
next to Kings Point. That's correct. Right next to the furniture place. Correct?
Yes.
There's a big billboard up front too. Something.
La Rue Furniture
Right.
in the plaza with the Papa John's.
So they're really right, folks. If you're living in West Del Rey, you want to go and see Dr. Voorn, and I can tell you, she got quite a resume. I don't want to tell you all the things she's done, but for a young lady, she's got quite a resume. I mean, she's done a lot of, let's say, you've done a lot of work for the underprivileged, correct?
Underserved, yes.
And you even went over to Dominican Republic.
Yeah, so I was president.
If you're not happy with the care you're getting, I strongly suggest you come pay a visit to Dr. Voorn. Again, not your phone number, the office phone number.
Yes. So 561-270-6950.
All right, so that again, if you want to know where it is, it's right next to
La Rue Furniture in
La Rue
between
Furniture.
Military and Jog on Atlantic.
on Atlantic. And there's a big billboard sign right up there, and so it's easy to find. So if you folks are living in, again, that major
Kings Point.
Kings Point, it's a walking distance to Kings Point. Am I
Yes,
correct? You
we
walk
have
there.
a lot
And
of
if you're
patients
shopping and
from
you just
there.
want to drop in and see their center and see what they do and see what they offer you, I think it's a fantastic thing to go
Yeah,
see.
we're actually offering $10 gift cards for anybody that comes by for a tour.
That's amazing. $10 gift card for a tour.
Yes.
Okay, and that gift card is hope to Publix so they can buy some food, right?
Yeah, it's a Visa card, right?
No, the ones we have now are Walmart.
Oh, Walmart. Okay.
Walmart.
Yeah.
Walmart cards.
So your
now.
$10 gift card, you go to Walmart, buy some food, or buy whatever you got to do just for a tour.
Exactly.
I'm coming by for a tour. That's
Yeah,
fantastic.
come by. We'd love to show you around.
Now, what makes you a little bit different than all these other centers?
The other managed care centers?
Right.
So I think it's the people that we hire and the physicians that you see. So myself, Dr. Brew, actually in our enterprise, we are top 4 in the what we call the net provider score. So a lot of our patients are very happy with the care that they're receiving, not only from the physicians, but from the staff. When you walk in, everybody's extremely friendly. Just the atmosphere is very nice. Everyone's extremely positive, and we treat our patients like family.
So when they get that blood pressure, they're getting that white coat syndrome with you. They don't get that white coat syndrome because it's family. It's like, hey,
exactly, yeah.
It's part of my family.
Yes.
And so a lot of these patients come just to pay a visit because they have nothing else to do. They want to come and see you. I mean, you're probably the closest contact they have to anybody talking to them in the course of a day.
Mm-hmm.
A lot of things that I find out treating with seniors for 40 years is loneliness.
Exactly.
A lot of these people, they're lonely and they're depressed, and a lot of depression sets in. They're getting older. And the family members haven't been talking to them lately, and they want to go in. And you could even treat depression sometimes with these patients.
Depression's huge in our patient population, especially with the COVID pandemic.
Mm-hmm.
So being that they have access to us 24/7, just having that reassurance that they have my cell phone number. I have a lot of patients that I talk to on a weekly basis, just providing that reassurance, talking to them, making sure that we address their depression, because a lot of times you just want to talk to somebody. You just need your doctor to give you a phone call, tell you everything's going to be okay. And I think that's what also sets us apart, is having that small panel of patients, really only seeing those 300 to 400 patients, having that access to your doctor 24/7.
So your center basically caps out at 300 to 400 patients.
Yeah, depending on your role. So my role as medical director, I'm seeing max 300. A normal primary care physician can see maximum 400.
So how many physicians do you have in your practice?
Currently, it's myself and another physician called Dr. Abreu, and we have another physician onboarding in September.
So each one can see up to 400 patients or 300 patients?
Yes.
So you really can have a population of about 1,300 people in that one center?
Yes, right now, but our plan is to grow. So we have a whole backside of our center where we plan to expand and onboard more physicians as we gain more members.
And these people now, there's a lot of things that you can provide for them, correct? Like you can provide, if I correct, Meals on Wheels?
Meals on Wheels. We offer acupuncture. We have a cardiologist in our center, so he's hired through our company. We also have a podiatrist as well.
That comes weekly or?
So the cardiologist comes twice a week, and the podiatrist comes bi-weekly.
Okay. And what hospital can you admit them to?
So any local hospital, we work very closely with Delray Medical Center because it is in close proximity to us. Bethesda East, Bethesda West, as well as Boca Regional.
Bethesda West is a great hospital.
Yes.
It's like going to a hotel room.
It's very nice.
I spent 4 days there, and I said, I'm not going home. Keep me here. So it was a fantastic experience for me to be at. They wanted to send me home. I said, no, I want to stay. I can't go home. I'll live alone. So I got another couple of days out of it. It was a great hotel. And how got a few more minutes there, Freddie? 2 more minutes. We got 2 more minutes again. Let's go over the phone number again. Brandon, we're going to get you involved in this conversation.
All right, very good. 561-270-6950.
Repeat it again, because a lot of these times, write it down,
and
folks.
this is Dedicated Senior Medical Center. We're at 5848 West Atlantic Ave, Suite 143, and that's right here in Delray, 33484. And the phone number again is 561-270-6950. We would love to have people come by and do a tour with us.
And listen, if you go by, you get a free tour. And I gotta say, Dr. Voorn will get you a gift certificate, $10 gift certificate.
$10 to Walmart.
That's free. So if you go by 4 free tours, you get 4 free tickets.
Yeah.
So go by as many times as you can to get a tour, and eventually they'll sign you up. I know they won't mind giving you a couple of extra free tickets, would you?
No.
No. See,
just bring us some more members.
Guys, how can you? What a beautiful smile this is, Doctor. How can you not go see her? So if you're a gentleman or ladies, you're on Medicare Advantage. Go and see Dr. Voorn. Again, thank you both for coming in.
Thank you for having us.
Hope we see you
Thank
again. And I guess we're finished, Freddie? We're finished. And folks, good night. Have a wonderful evening and a wonderful week. And be safe. Wear your mask and social distance.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding